Tracy, I'm gonna ask you to put that cell phone away so we can talk about a few things.
Oh, okay.
All right?
Yeah.
Okay.
I'll just put it.
Okay, that's fine, that's fine. I just need to go over this, paperwork here, this form, which is our process of care, which just means, what our plan of action is,
Okay.
okay? After I've done all the assessment, right?
Mm-hmm.
So I've looked at your, medical and dental history,
Okay.
okay? And, then we did all the exams,
Yeah.
okay?
That was a lot. Yeah.
Yeah, I know. So, some of this we've already done, but I'm going to, hopefully, if it's okay with you, I'm gonna go over some ways that maybe that can help you improve your oral health.
Okay.
Because you know you're having that sensitivity and stuff, so we really need to address that.
Mm-hmm.
And your, diabetes,
Yeah.
you know, how that's gonna impact your
Oh,
oral
that
health.
matters.
Yes,
For
yes.
my mouth.
So we're gonna
Okay,
talk
can't
about
wait to hear
that.
that.
Yeah,
Okay.
so we're gonna talk about that. So, and you also have a couple of cavities.
Oh, I do.
Yeah, Dr.
I
Anderson.
thought I heard that man say that.
Yeah.
That was
yeah.
the dentist. Yeah. Okay.
So we wanna, we don't want you to have any more,
Okay.
all right? So we need to prevent those. So we're gonna
I
talk
thought I was
about,
doing good.
yeah, I know. We're gonna talk about some of that. So, I'm gonna do some forms on what you, eat. Because
Okay.
that impacts the cavities, okay? I'm gonna scale your teeth above and below the gum line, right?
That means scaling is like when you scrape them.
When I scrape them,
Okay.
exactly.
Okay.
And,
I don't like that part.
I know.
Teeth are so sensitive.
Yeah. And then we're gonna I'm gonna polish and floss and give you a fluoride treatment.
Okay.
The fluoride should help with the, cavities, okay?
Okay.
And we already took that, FMX on you, the
Yes.
full mouth series, okay? So we're gonna take a look at that.
Okay.
So, we're just referring you to the dentist, to your dentist, Dr. Smart.
Hmm.
We're gonna refer you to him for your, to get your cavities filled, okay?
Okay.
All right, so on the back here, you see that you're consenting for what I just told you, okay? And, also, I want you to be aware that we can't be responsible for a non-diagnosis or misdiagnosis since we're an educational facility,
Okay.
okay?
That makes sense.
Yeah, and if you have to cancel any appointment, if you'd give us 24 hours, that'd be great, okay? Because the students are always looking for good patients,
Mm-hmm.
okay? So, first thing I wanna talk to you about is I'm gonna get you to fill this out real quick, okay? It shouldn't take but a minute. So we can talk about, the cavities, okay? Because that's really important. So if you would just write down what you ate the last 24 hours for breakfast, lunch, dinner, and any snacks that you can remember. Do you drink your coffee with sugar?
Mm-hmm.
You do?
I do.
Okay. How many cups did you have?
I usually drink 2 in the morning.
Okay. And then you had a banana, right?
Mhm.
Okay, yum. And then you had some juice, so that's like a fruit juice or?
Apple
'cause
juice.
You report that on your little form
Usually
there.
apple juice.
You
I like
usually-
orange juice too though.
Yeah, okay, so you had some juice, okay. And then for lunch, okay, so you had a salad.
Mm-hmm.
Okay, so what was in your salad? Lettuce,
Lettuce, tomato, cheese, and chicken.
okay. Did you have any croutons on that?
I did.
Oh, okay,
Yeah, I
let me
forgot
add
about
that.
those.
What
Mhm.
kind of, did you have dressing?
I did. Ranch dressing.
Okay,
Mhm.
all right. And so, did you drink anything?
I had sweet tea.
Okay. All right, and then you had some chips for a snack.
Yeah, but it's the baked chips because I eat healthy. So.
Oh, you eat healthy, so it was the baked chips.
Yeah.
Okay, let me just change that because I just assumed that were the fried ones. Yum, so good, isn't it? All right, tea for dinner with sugar in it.
Mm-hmm.
Okay, and then you had some grilled chicken, green beans, and you had a baked potato.
Mm-hmm.
Did you have butter and sour cream?
Just butter, no
Just
sour
butter?
cream.
Okay, and salt and pepper on it?
Mhm.
Okay. And then, because because I noticed you reported on your other sheet that you really like to chew juicy fruit.
Yeah, well, my mouth is so dry,
Mhm.
so I have to have gum to make
it.
Yeah,
I
and
gotcha.
juicy fruit just seems to be the juiciest. So yeah,
Imagine that.
yeah.
All right. Well, I'm
So
going
it
to just
helps
do
a lot.
something real quick over here, because what I'm going to do is we're going to look at how cavity promoting your diet is, because your diet will impact getting cavities,
Oh, even though I don't eat desserts?
even though you don't eat much sweets.
Really?
That's correct. Yes. So,
Okay.
for instance, you had the sweet tea, right? And so if you had tea without sugar in it, then it would not cause or help to cause a cavity, okay? For instance,
Oh.
as well as your juice, okay? That's
I
going to
thought
be,
juice was good.
well,
for
it's,
me.
it can be good for you
Mhm.
nutritionally, but we're talking about just the mouth. Just the mouth,
Never
okay?
thought of it that way.
Right, just the mouth, because you're having those cavities, and of course, the dry mouth is also
Mhm.
contributing to that,
Okay.
because you don't have enough saliva to cleanse your mouth
Yeah. Okay.
Yeah.
That makes sense.
of debris, when you eat, etc.
Mhm.
So banana's good for you, but of course it's going to be sticky and cariogenic.
Yeah.
Okay.
I do notice it sticks to my teeth.
Yeah, and then you had the croutons, so that's also would make the salad, because it's a carb, it's a carbohydrate.
Oh.
Okay, so if you didn't have the croutons on your salad, you'd be good to go.
So that could be, but make it better.
Yeah.
Okay.
Mhm.
I can do without croutons. I don't
Okay.
have those.
And then you had your baked potato,
Uh-huh.
so that's also a carb, right?
Oh.
So that's going to impact getting a cavity.
Hmm.
All right.
Really?
Yeah. And your chips.
Didn't know that.
I know you baked chips, you thought, but really they're made out of
Even though they're
potatoes.
baked.
Yeah. It's still just the mouth.
Okay.
Okay. And then your gum, the juicy fruit, has a lot of sugar in it,
Mhm.
and so that also impacts as
Hmm.
well. And you also leave the gum in your mouth for a long time,
Mhm.
right? So it's in there.
So gum is bad.
Not all gum is bad,
Mhm.
okay?
Okay.
So gum that is sugar free is
Mhm.
fine,
Okay.
okay? And xylitol gum,
Mhm.
which if you look on the packaging of gum, it's going to start with an X,
Okay.
okay?
I think I've seen that.
Yeah.
I wondered what that was.
And so that's really a natural sweetener
Mhm.
that is really good for your mouth.
Oh, I thought it was something the government was putting
Right.
there trying to kill us all.
Right, exactly. But no, it's really
So it's good
good.
for you.
And the mannitol and sorbitol you might see on the gum packaging is also really good. So if you could just make that switch,
Mhm.
that would really help with this.
Okay. That's
You
an
know?
easy switch. I can do
Yeah,
that.
you think you can do that?
Mhm.
Okay.
Good
And like
to
you
know.
said, if you didn't have the croutons, okay? So let's just say, for instance, that you take out the gum, okay? We're gonna take out the gum here, okay? And we are going to take out the croutons,
Yeah.
okay? So then that would, let's see what that would do here, 6, and that would be 0. So that would really bring you down here on our Caries potential,
Right.
okay? That would bring you down to 8 when you were at 13,
Oh, wow.
and that would still put you at the very bottom of a high risk,
Yeah. But I've,
which before you were way above. If you
Yeah.
just make those changes,
okay.
and so
So then I might not get cavities like I've got.
right, right. So like with the chips, do you like nuts or popcorn?
I love, I love nuts. Mm-hmm.
So that would be probably a good switch you could make there.
Yeah.
And then that would bring you down into the moderate risk.
What if I did carrot, the little carrot chips?
Oh, yeah.
Because I really do like that.
Oh, okay.
Instead
Yeah.
of baked chips?
Yeah.
Okay.
Yeah.
Because I
You
like
could
the
do something
crunch.
like that. Yeah, the crunch of it. Yeah.
Okay.
And popcorn and nuts also have that
Mhm.
crunchy thing going on.
Mhm.
So that would really bring it down too.
Okay.
Okay. So Just
I can do
those,
those things.
yeah, just those simple changes would help you as far as that. So if we look at this just real quick, this is what you said, and I kind of filled in the blanks a little bit from what you said.
Okay.
So now that we've talked about it, so what would you think would be carryover?
Okay.
Would be
Well, you taught me a lot. So
Yeah.
things I didn't know, but I'm gonna say my juice. And my sweet tea. You said croutons. My chips.
Yep.
Oh, and my gum.
Yep. Okay, so see right here, you had sweet tea again,
Oh yeah, I forgot that one.
and then you had your potato, right?
Yeah.
Because the potato's a carb.
Okay.
So anything that's
I did
a
forget that one.
carbohydrate,
Mhm.
it's gonna lower the pH in your mouth, the acidity in your mouth. You want to keep the acidity in the mouth neutral or above neutral as much as possible.
Okay.
All right, and when you eat these and drink this, then it brings the pH down, and the mouth becomes more acidic and dissolves enamel.
Okay.
So that's kind of
I
what
don't want to do that.
yeah, that's kind of what we're looking at here.
Okay.
And so, but for instance, okay, and your banana is going to be cariogenic.
Yeah, you did tell me that.
It's very good for you, and it's going to be sticky, so it's going to stay in the mouth longer,
Okay.
promoting decay.
Okay.
Okay, but like your juice, tea, anything liquid doesn't stay in the mouth that long. You know, it just goes right down.
Okay.
Especially like if you drink it through a straw,
Right.
it's going to shoot right down to your throat and not.
Oh, and bypasses the teeth.
Yeah.
Okay, that's
Yeah.
a great idea.
Yeah. So, because I know, I mean, it's hard to give up sweet tea.
Yeah. But with my diabetes, I know my doctor tells me I don't need to drink it, but I just never really thought about it affecting my teeth.
Yeah, it can do
That
that.
makes sense,
It can
though.
do that as well. Exactly. Yeah. So that diabetes is something we've really got to. We're
Yeah,
going to talk
so that
about
would help
some.
my diabetes and my teeth.
Okay. So, and if we look right here, I know it says children, but it's the same.
Okay.
Okay, it's the same. This is showing you the pH.
Yeah.
Okay, so this is the line here is like a critical pH where anything below that is going to dissolve the enamel. Okay, and it happens every time you eat. Okay,
Okay.
so we want it to stay up here.
Right.
But you notice the lines going up and down and up and down? Okay, so what that is telling us is that this person, the pink line, okay, don't look at the blue line right now. The pink line, they're having a lot of exposure. So they're eating, this person is eating a lot of cariogenic or cavity forming foods throughout the whole day.
Oh.
So the
probably
pH is going like this.
a lot like me with my gum.
Yeah, with your gum. But this person, you know, it dipped down here at breakfast.
Yep.
Then it takes a little bit for it to come back up, right, after you get done eating. And then it stayed above it. Then it dipped back down at lunch probably, you know. But it stayed up here, so we don't have that up and down. It stayed above the
Yeah.
critical pH
Okay.
more than below it. So
I've never had anyone explain
So
this
for
to me.
instance, if you want to have your chips, let's say, for instance, and you're having a salad,
Yeah.
okay, just while you're eating your salad, have your chips,
Okay.
because that will only be one exposure. It'll only
'cause it's
lower
all at
it
the same
one time
time.
because it's all at the same time.
Okay.
But like, you know, if you're drinking that juice, like you said a lot, and chewing that gum, then it keeps it below
Right.
for a
Okay.
long time.
Okay.
And you know, and we want it to stay up here. So this is really important for people, especially you with the dry mouth, and we have 2 cavities.
Yeah.
Okay.
Okay.
All right. So just if you're gonna have something, just have it all at once.
I can do that.
Don't sip on your juice all day.
Okay.
Drink it down, and then
And
then
get
be
some
done
of
with
that
it.
The X gum you talked about.
The X gum.
Yes.
The X gum will help if you have that like right after,
Okay.
you know, to keep your mouth, which I
Okay.
understand with the dry mouth. And I'm gonna write some of this down for you, but with the dry mouth, one thing that's important, you can buy saliva substitutes, like Biotine. If you go in the store, there's several.
I've seen those.
Yeah, so you can try that and see if it helps.
Okay.
But there are also prescription medications. Okay, so do you know the cause of your xerostomia?
I really don't. It started about probably a couple years ago. Kind of about the same time they told me I had diabetes.
Okay. Okay. But your diabetes looks pretty well controlled though, right?
Yeah, we've worked really hard at that.
Okay. So, and you do have the high blood pressure, and it looks like, yeah, some of these medications might be the culprit.
Of my dry mouth? Medicines?
Can dry your mouth out. Yeah,
Really?
Unfortunately. Yeah.
Oh.
Yeah. And
Well,
so,
yeah. And
yeah.
I started taking those medicines a couple of years ago when my dry mouth started.
So,
Okay.
you can talk to your doctor about taking something for the dry mouth
Okay.
if you feel like it's that bad.
Okay.
Okay, but if you're managing it, drinking, you know, water, of course, is the best, and then the xylitol gum. See what that does for you.
Okay.
Okay,
I can
all
do
right.
those things.
Because your diabetes, you know, we've got to keep the oral cavity healthy, because that'll impact your diabetic state, your status of your diabetes, and vice versa. Your
Really?
diabetes can negatively impact your oral cavity, your mouth.
Really?
Yeah. So the two of them are very related. Yeah. So we've got to keep the mouth healthy, and that'll help keep your diabetes straight.
Okay.
Keep your blood sugar straight.
Okay.
Okay. So another part of keeping your mouth, you know, of course, healthy is brushing and flossing, right? So your X-rays here, you got a cavity over here. Okay, they're on the back teeth, and they're one on each side on the top.
Okay.
Okay.
Back here and back here.
Yeah, but you're not having any pain. So we need to go ahead and get that taken care of. Okay. And also, I've noticed some of your teeth don't have sealants on them, and so a sealant is like a plastic coating we can put on top of your teeth, and you can come back here and have that done, and it'll keep you from getting a cavity.
Okay.
You know, or at least it'll help you to keep you from getting a cavity. Okay. All right. So as far as brushing and flossing, okay, so you use a hard brush. That's what you said on your
Yeah, I love it.
Oh, you do? Well, but you also reported that cold sensitivity, right?
Yeah.
Okay. So, so with the cold sensitivity, that's probably due to, because you said you have it in the posterior, although usually cold it's not really the cavities. That's usually a hot sensitivity, right? So, but you do have recession. So what that means is that the gums have moved away from the where the enamel is on the tooth, so you have roots exposed.
Oh, I thought only old people got that.
No, you are old.
Wow.
Let's go ahead. You want to open, Tracy, and let's just take a look. So just look in there and see. Why not have the light? Okay.
Lots of.
Where do you see it mostly?
In the back. Yeah, I missed a lot.
Yeah, on the gum line there, see that? And then let me just show you, see, so I remember I was telling you we get a lot here, so you can see that, you know, yeah. All right, so we gotta work there, okay. Some of that down there though is probably tartar, you know, the hardened plaque.
That you have to scrape off, yeah.
So that's probably what some of that is too, but so the gum line, like I said, good girl, so don't worry about it. Oh, so the recession is likely due to the fact you're using that hard brush, and the fact that we're going to take a look at how you brush, your toothbrushing method, okay?
Yeah, I thought the hard got it off better.
Right, right.
Huh.
Well, plaque itself is very soft.
Mm-hmm.
So a soft toothbrush is gonna be fine for getting
Really?
it off, yeah. Now, if it stays on there too long, and it'll start to get hard,
Mm-hmm.
and then the toothbrush can't get it off. Not even a hard toothbrush could get it off.
Oh.
So that's why we have to scrape
Scrape. Yeah.
Yeah.
Okay.
to get it off, because it's like little rocks on your teeth.
Mm-hmm.
But you don't have, I mean, you have some, but as it gets above the gum line and below,
Mm-hmm.
sometimes you can feel it, like you might feel it down here.
Mm-hmm.
Do you feel
Yeah,
anything
a little
down?
bit.
Yeah.
A little rough.
Yeah, and that's where we find it a lot. So we're gonna, if we need to switch to a soft toothbrush, okay? Because then it protects your gums as well as,
Okay. You gonna give me one?
well, I do have one for you, but before we talk about that, as far as plaque goes, is there much you know about it?
I mean, yeah, it makes I think it's that it makes my teeth, I say it makes my teeth feel like they have sweaters on them.
Mm-hmm,
Like they feel fuzzy
mm-hmm,
after I eat.
mm-hmm.
Yeah. Is it that?
That's it,
Okay.
yeah, that's it.
Yeah.
But it's continuously forming.
Mhm.
It doesn't have anything to do with when you eat.
Mm. Oh, I thought it was because I was eating. When I
Right,
would eat. Okay.
Right, no, only when you're, it's always forming, so it doesn't have anything to do
Okay.
with your, eating.
You're really smart. You've taught me so much.
Thank you so much. I do try to keep, up with the newest technology,
Yeah.
and so that's what I wanna show you is this power brush,
Oh, wow. That's
Right.
fancy. Okay.
okay? Because since the plaque is forming continuously, you know, we recommend that you brush twice a day
Mm-hmm.
to keep it off, and that's what you said you were doing.
Yeah.
You're brushing
Yeah,
twice a
I
day, so
do.
that's great.
Mhm.
And then you said you floss once a day, which
Mhm.
is really awesome, because most people don't floss except when they maybe get food in their teeth,
Mhm.
right?
Mhm.
But I do want to show you this
Okay.
on this model here. All right, now students, you notice that when I do this, the toothbrush is going out of the mouth, not into the mouth like this, because somebody's not gonna have this thing going down their throat. Got it? Okay. All right, so this is a really great toothbrush. It is expensive though, okay? And there are different models that you don't have to spend this much. This is just the best that, you know, it has tongue clean on there.
Oh,
So your tongue is a little bit coated. I can tell you brush it as best you can.
Mm-hmm. I've noticed that.
Yeah, and that also helps with bad breath,
Oh, okay.
okay? Because plaque has microorganisms in it,
Mm-hmm.
bacteria. Some is good, some is not.
Mm-hmm.
And it also gets on your tongue.
Mm.
So we do want to kind of scrape it or brush it or something,
Yeah.
okay? So, all right, now it's telling me hello, and now it's still on tongue clean. So I'm going to put it on daily clean.
Okay.
Does that sound good?
Sounds good.
All right, so this is a little bit different than a regular brush, okay? So,
I've been thinking about getting one of these.
really? So you don't want to do like this with it? Like you
Oh.
might do your regular brush,
Yeah,
right?
That's how I do it.
That's how you brush probably, right? Like
think
that?
so, yeah.
Okay, so. Oh, it also has a sensitive setting, and you have that sensitivity.
Oh.
Okay, so I've got it on the sensitive since you've got that sensitivity, okay?
Okay.
Okay, so when you use this, it's really easy because you just want to tilt it way in there so you kind of get in between the teeth, right?
Yeah.
Then come across on right at the gum line and then like that.
Okay.
See that? Then like this.
That's
So you're
easy.
brushing like each tooth individually.
Yeah, and I like how it lights up.
Yeah. And see if I push too hard, see it got a little darker green? Because I'm pushing hard.
Oh yeah. Oh.
Oh.
Oh, it turned red.
Yeah, because I'm pushing too hard.
That is so cool.
Yeah, so that's what I was saying about it being soft.
Yeah.
This is all that it really takes to get it off. But you want to get up at the gum line because any plaque that's up here is going to cause your gums to be inflamed, okay?
Okay.
All right. So this is what we call a quadrant,
Mm-hmm.
okay? So then you need to brush. The inside as well.
Yeah.
Okay.
Okay.
So, and then you have to brush, and we'll do it down here, be easier, the tops of the teeth.
Oh yeah.
So just kind of tilt it, you know, like this. It's getting in all the, there's lots of, you know, grooves in your teeth. But I mean, see, I barely, look at that. I mean, I'm not putting hardly any pressure, and it's already turning that dark green.
Yeah.
So it keeps you from doing that, which will really help with that recession. Okay? So we recommend, and I'm just going to leave this running, but we do recommend that you brush for 2 minutes.
Okay.
So what that means is you've got 30 seconds here, 30 here, whatever order you want to go in.
You said it was a quadrant, so in each
Yeah,
quadrant. Okay.
yeah. Okay, so now I went over 2 minutes.
Okay.
So then I turn it off and I get a big fat smiley face
How cool is that?
because I brushed for 2 minutes.
Okay.
All
I
right.
love it.
Yeah. So you would, whatever sequence you want to go in, and you want to always go in a sequence because then you don't miss anything. You know, if you do it the same way every time. So wherever you want to start, and then, but always remember to do the insides too, especially on the bottom,
Okay.
to do the insides.
Yep.
Okay. Up here, I mean, you want to do it, but you get a lot of tongue action up here.
Right.
That helps to keep your teeth cleaned on the inside of the top.
Oh,
Yeah.
that makes sense.
This right here is where we see a lot of buildup
Okay.
on that bottom part, okay? So this is the best technology right there, okay, is that power brush. But let's just say, you know, you're out, or you go on vacation, you forgot your power brush, you gotta use one of these, okay? Which, you know, I mean, this has its place, right? The manual brush, this is soft, because you always want, like Oral-B is a really good brand, and you always want on your, any of this, you wanna see the ADA seal, which I don't see it on here, but it's probably on the packaging. And, but American Dental Association recommends this product if it says ADA seal on it.
Okay. I've seen that.
Okay, so you want to be sure and purchase those products. Now, what would you, is oral health a priority for you?
I would say so.
Okay, like on a
Yeah.
scale of 1 to 5, if 1 being like I don't really care,
I'd probably say 4.
a 4? Oh, okay, good.
I think I do pretty good at it.
Yeah, yeah. You don't, you
I
know.
mean, I brush real hard, but I mean,
Yeah.
you're kind of making me rethink that. But
Right.
I've always thought I did good because I brush
So
real hard and scrub usually.
Right.
So
Okay.
I want my teeth to be clean.
I gotcha. I understand. Well, what I'm going to do is I'm going to wet this toothbrush.
Okay.
Okay. And I'm going to let you use it.
Okay.
Okay. And I just want you to brush like you normally would at home. Just whatever you do at home with your manual brush.
Okay.
Okay.
Just go.
Just go.
Okay.
Uh-huh. Okay.
I usually do the front ones a
Like,
lot.
A lot.
Yeah, because
You know. Well, you want to have a good smile. Okay. All right. So that was probably about a minute of brushing. So once again, students, do not have the toothbrush going back into the patient's throat. Okay? All right. So, you know, you were brushing very vigorously. Okay? So we already know that that's not really great.
Yeah.
Okay? So when you're using you're going to use this. It's kind of like what you were just doing with the power brush. Except with this one, you're going to angle it up like this, so you're getting up at that gum line again. See how I'm just angling it and and you want to use shorter strokes because you were like covering the whole quadrant with one stroke.
Yeah.
You know, so and then you just want to jiggle it.
Okay.
And if you want to, you can sweep down if that makes you think you're, but this is the important part, is getting up at the gum line. See there?
So that makes it go under the gum.
Yeah, just a little bit.
Okay.
Okay, just a little bit. This toothbrush is kind of big, but see there? And using short strokes.
Yeah.
Okay, so that's really all you have to do. See there? And then when you get here, and you kind of did this too, you did the vertical like that. Yeah, that's kind of what you were doing. You get a little bit of that, but this will work real nicely down here.
Okay.
Okay. And when you were holding it, you kind of had a baseball grasp like this, which will make you brush harder. So you kind of want to hold it just lightly like this. Get this finger up there a little bit because it'll help control it better, like this instead of like that or like that.
Yeah.
Okay.
Okay.
So that would be a good manual way to use a manual toothbrush. Okay. So now what I'm going to do is I'm going to lay you back and I'm going to put this disclosing solution on your teeth. Okay. So what that does is, since a lot of times plaque's invisible, okay, you can't really see it unless it's really thick, and sometimes you can see it because it can be really thick. If you're missing someplace all the time.
Yeah.
So we can look and see how you did with that toothbrushing you just did. Okay. See, now that I showed you how to brush, okay, so I want you to, I'm gonna wet this again, and I want you to see if you can, how well you can try to do that modified bass.
Like what you showed me?
Yeah, that technique I showed you.
Okay.
That's good. That's
Really
really
good?
Yeah, that's all you have to do.
Really?
There you go, on the tops of the teeth. Yeah. All right, let me see you do the bottom. Somewhere on the bottom. All right, be careful not to get too, on the bottom, you need to turn it this way. Not down here. Turn it up. There you go, and sweep up. There you go. Now get your grasp better. There you go. That's a good grasp like that. Yeah. Okay, so that's what you need to do if you're, there you go. It takes a little practice. But even if you're soft circles, small circles would be okay too. If you can't quite get that, just use real small circles.
But don't do this.
Don't do this.
Okay.
Okay?
All right.
All right, nice. Okay. So, how many children do you have?
2.
2 children. Yeah. And we've never seen them. Okay. How old are they?
A 6-year-old and a 3-year-old.
Okay. So do they go to the regular dentist? To your dentist? No, they don't. You've never taken them to the
No, I
dentist?
wasn't real sure when to take them.
Okay, well, we need to go ahead.
Both of them? Even my 3-year-old? Ah.
They're really a little bit behind,
Okay.
but that's okay. The dentist will just look at how they're doing, brushing their teeth, and they'll also look at the development of the teeth.
Okay.
Has the 6-year-old lost any teeth?
Yeah, he doesn't have his 2 front teeth right now.
Okay.
He's lost those, and he's already gotten these on the bottom.
Okay.
So,
Okay.
yeah.
So that we can look at, how the other permanent teeth are developing.
Okay.
So baby teeth are very important, but then we, need to look at to make sure we don't see any problems down the road.
Okay. I've been thinking about taking them because his breath stinks a little bit like that.
So Tracy, with the toothbrush, you know, how often do you get a new toothbrush?
Well, I probably get one about 8 or 9 months. I use it.
Okay.
I use it till, usually, probably about 8 months.
Okay, so you do see your dentist. Do you see your dentist? I can't remember what you reported. Okay, you do say
Like once a year?
once a year?
Mm-hmm.
Okay. So we do kind of want you to go a little more often than that
Oh,
to see the hygienist.
even though I'm do so good, I still need to go twice a year?
Yeah, yeah.
Oh,
Because remember I said when that plaque gets hard,
yeah,
and then that's when we get into the whole gingivitis thing.
yeah,
Okay.
that's true, yeah.
Yeah, and the cavities.
Yeah, I forgot
Okay,
about
that plaque is got the germs in there,
Mm-hmm.
and it's gonna cause the cavities that you have too, along
Yeah.
with your diet.
Right.
Okay. And so with a toothbrush, you need to replace it probably, a lot of people wait till they go to the dentist and get a new toothbrush, which is like once every 6 months. Most of the time that's you need to replace it in between.
Oh, okay.
Okay. So like every 3 months. Okay. If you get sick, you probably want to replace it
Mm-hmm.
because you're going to have the flu germs on there or whatever,
Mhm.
right? And it's the same thing with this one.
Mm-hmm.
And especially because I want you to adapt the new way of brushing. If you brush really hard, your toothbrush is going to wear out faster.
So I gotta buy a whole new thing
No,
every
no,
3
no,
months?
no.
Oh, that comes off.
Mm-hmm.
And I just buy that part.
That's right.
Okay.
Okay, so you just buy that. We did see the tongue thing, the tongue
Mm-hmm.
clean on that,
yeah.
right? And
Yeah.
so, yeah, but if you don't get this toothbrush, there are tongue scrapers out there.
I have one of those.
You do?
I just don't use it, but yeah, I do.
Oh, okay.
Mm-hmm.
So sometimes people do better with these as far as gagging,
Mm-hmm.
So all you do, is just take it and just scrape the tongue. There's different ones
Mhm.
out there,
Okay.
just whatever you like.
Yeah.
Now you can also brush your tongue with your toothbrush, but a lot of times people will gag, with that. And
Mhm.
sometimes I've noted on the back of toothbrushes there's a little ridgy,
Mm-hmm.
and that's for your tongue as well.
Oh, I wondered what that was for.
Okay.
Okay. Yeah.
So we want to keep that tongue clean. It'll help with bad breath, etc., and the microorganisms, the bacteria that's in that mouth.
Okay.
If the tongue is coated, there's going to be a lot of that.
Yeah.
Okay. So now your sensitivity. So we talked about the brushing. Okay.
Yeah.
And I would recommend
Sensodyne.
a toothpaste for sensitive teeth.
Okay.
Now it sounds like you're pretty sensitive, at least right now. So we
Yeah.
do sell this.
What is that?
Well, it's a prescription strength sensitivity toothpaste. So it's stronger.
Okay.
So this thing, which would last you a long time, it's big, we sell it for $15,
Oh, wow.
which is about half of what you're gonna pay at the dentist,
That's a great deal.
okay?
Mhm.
So we do have that.
Okay.
And also this Booster Plus also would help with your plaque removal and the cavities.
Okay.
Okay,
I'll
so-
use that. Yeah.
Yeah, but
Or
either or
yeah.
both. This one has the what potassium nitrate, which helps more with the sensitivity, but they both have a lot of good fluoride, which
Mhm.
helps with sensitivity.
Okay.
Okay, so I would recommend one or both or whatever
Right.
with that. Okay, and then you didn't report any bleeding gums, right? So your gums don't bleed, so that's really good as far as especially with the diabetes. Okay, and we talked about your dry mouth, right?
Yeah.
And made some recommendations for that as well. And I'm going to give you a fluoride treatment, so that's going to help too with the sensitivity.
Okay.
Another thing you can do with these toothpastes is where you're sensitive. At night before you go to bed, just take the toothpaste and rub it with your finger on the recession,
Okay.
right? And just leave it there. Just spit, but don't rinse.
Right.
And just let it sit there.
Okay.
Okay, so that might help with the sensitivity as well. But right here, I did want to show you real quick just what can happen gingivitis, really the bone level around your teeth, we saw in the x-rays, well I didn't show you, but it's fine, it's really good. You know, your teeth are in bone, and you want to keep that bone healthy. So, and you remember when I probed your teeth, and I told you about the 1 to 4 and all that, okay? So this is pretty much what you look like, healthy, okay?
Good.
We can just get rid of those cavities, right? But this can happen too with the plaque, okay? You know, biofilm, it's really a biofilm, you know, like what gets in the bottom of your dog's bowl, that slimy stuff.
Yeah, well, I have cats, but yeah.
Yeah, that's what you know, that kind of thing. That's really what it is. And you have to manually get that off, okay? So, if not though, what can happen is the gums can get infected.
Okay.
Right, just like if you have a cut on your arm.
Yeah.
And it gets all red. That same thing can happen in the mouth, okay? And it can lead to some bone loss here. See how the bone is going away? And there's the calculus or the tartar.
Yep.
Okay, that's under the gums. And it can eventually, see how far down the probe's going?
Oh yeah, it can get really bad.
So when before it wasn't that far down. See how far down that is?
Yeah, I don't want that.
See that?
Yeah.
So, you know, you really don't. And you can lose your teeth.
I have a cousin whose teeth look like that.
Oh, really?
Yeah. Probably need to send him to come see you.
Tracy, what type of floss do you use, or do you know?
I usually just buy whatever's cheapest. Yeah.
Right. And there's different ones, different, you know, types of floss out there. I just want you to use whatever you like the best.
Well, sometimes I get some and it's like hard to get through my teeth. I feel like my teeth are tight together.
Yeah, because you do have a little bit of crowding.
Yeah.
So that will, in that front there especially, so that sometimes some floss, it's harder. Does it ever shred on you? Yeah. So, I don't know what I had here. Okay. This is satin floss, okay? There is, and I would probably recommend for you, and it's what I use, I like the better, you know, there's different thickness of floss and some has wax on it, then that helps it slide in there better. And if you have a little thicker floss than what I was using, then it covers more area, you know, it just seems to, I mean, for me personally, it seems to me to do a better job.
Yeah.
So, you know, whatever, you might want to try some different ones and see what works the best, but especially with that crowding, I would recommend a waxed to get down in there better. All right, with your flossing, girl, well, first, I want you to show me how you floss. What am I doing?
Okay. Go ahead inside? Okay.
Do you need a mirror, or are you good?
I do 2 at a time.
Oh, yeah. That's kind of the way my husband flosses.
That way it's faster.
Yeah, that's a lot faster. But you know, if you floss correctly, it doesn't take that long either. So with your flossing, it's real important to floss because you need to get between those teeth. If you're not getting between the teeth, then you're not cleaning all the surfaces of the teeth.
Yeah.
Okay, so particularly with how you were flossing, you have too big of a piece you're putting between the teeth. Okay, so what can happen there is you can like hurt your gums. Have you ever like hurt your gums when you're flossing, like it snapped in there and it hurt?
Got like a little cut, sensitive spot.
Yeah. So we need to try to avoid that.
Okay.
Because you can see here on this picture, see how short that floss is there?
And they're only doing one side at a time.
See there? And see how right here it's wrapped? You see that?
Yeah, I've never done that.
And see how it's going a little bit under the gums?
Oh, that's interesting. Okay.
Yeah. The more you can get any cleaning under the gums, the better. Okay? So, that is very helpful. So, you know, a piece of floss about like this is good. You don't want to get, and you know, you might need more. Okay?
Okay.
So, just to show you how you want to start out, okay, is to wrap some of it around that middle finger, okay, and then I'm going to wrap a whole bunch on this middle finger.
Okay.
Can you do that? A little bit on one side. It doesn't matter which side.
Okay. Like that?
Yeah, yeah. So
Alright.
maybe a little shorter. Okay. So see, you only want like about that much to go in between your teeth. Look.
Oh, okay.
See there?
Yeah. Like that.
Okay. So if you wrap it around your middle finger, then you're going to guide it with your thumbs and your
With these fingers.
yeah,
Okay.
and pointer.
All
Okay.
right.
So you're going to put it down between the teeth, and then you're going to wrap it.
Like that?
Yep. Let me let you look real quick.
Okay.
I'm going to hold the mirror so you can see. So put it down in there. There you go. Now wrap on one side. Now do the other tooth. Good. And pull out.
Okay.
See there? And you didn't hurt yourself.
Mm-mm.
All right. Do it
Actually,
now.
felt really good.
Now, hold on. Because you have to. So let's say I got a bunch here, right? Okay. So then that's the piece of floss you used. So you don't want to put that down in the next tooth because that's got plaque all over it.
Oh.
So you're going to go like that and get a clean piece.
Okay.
Just use a clean piece. I don't know, however you want to. See, I just
Get
do
there.
it. However you want to get there. Use a clean piece. So, okay. So let's see you do it again in another tooth. Okay, now get a clean piece, however you do. There you go. See, you're doing my job for me. Look at all the plaque and you're getting off that I don't
Wow.
have to get off.
That's crazy.
So I know I've given you a lot of information, okay? So I do have some pamphlets for you, all right?
Oh, good, because I won't remember all this.
I know you won't. And so I've got you one on blushing and flossing,
Okay.
okay? And then your sensitive teeth,
Oh, good.
okay? And then a little bit on your power brush,
Okay.
Okay.
Yeah, that way I'll remember which one to get.
and then a little bit on your diabetes.
Oh, good.
So
yeah, I
let's-
really want to look into
Yeah,
that.
so take a look at this and you'll see it'll be a little bit better, for you to remember. You got to keep that in mind about that diabetes, okay? Because we want to keep your blood sugar in check
Right.
at the right level, and then we also want to keep your mouth very clean, and that will really help with the blood sugar.
Okay. Well,
Okay.
thank you so much. You
Yeah.
taught me so much today.
And so I'm going to
I
give
hope
you
you
this.
got an A.
I'm going to give you this Sensodyne.
Okay.
Okay, you can have this. I'll probably get some more from back there. I'll see how much we have.
Okay.
We usually have a lot of toothpaste, and so we can give you more. And also, if you want to purchase either one of these, okay,
Yeah, I
you'll have to
do.
get with Mandy in the front
Okay.
about
Yeah, I
purchasing
definitely want
those.
to get one of those.
Okay, so
Okay.
you can think about it and decide, what you might want to do there with this, or both of them even. They just have that lots of good fluoride in it, and so
Okay.
that'll really help with everything, the cavities and the sensitivity.
Okay.
Okay, and it'll keep you from getting more cavities. And then don't forget the sealants we talked about.
Yes. Okay.
So, but get your those teeth filled first.
Okay.
Okay.
I will.
All right.
All right.
Tammy, I know we're going to take a look at what I have here as far as after looking at all that assessment data, right? Which is your medical and dental history, okay? And then all the exams I did, right? Your head and neck, soft tissue, all that looked good.
And all that poking.
All that poking, did that, and you tolerated it well. Thank you very much for trying your best to be a cooperative patient. We all know that it doesn't feel good. Okay. So this is what we're going to do today, hopefully, if it's okay with you. Okay. Because this is your consent.
Okay.
So I want to do a little bit of counseling with you to maybe help you take better care of your oral cavity, of your mouth. Okay, a little bit of counseling. Then of course I'm going to be scaling your teeth above and below the gum line. Okay. Oh boy, I know. That it's one of those necessary evils. And then we took the bite wings, and so that's pretty, about it. I'm going to polish your teeth and floss them, and I'm going to give you a fluoride treatment.
Okay.
If that's okay.
I'm not crazy about fluoride.
You're not?
Why are you doing it anyway?
Well, that fluoride is going to help you as far as decay, getting cavities. Okay. You don't have a lot of cavities that you previously, but you do have some recession,
Okay.
right?
Right.
Where the gum has come away from the tooth, and so it will help with that if you're having any sensitivity in those areas.
Okay.
Okay, so that'll
Okay.
really help with that. And I'm going to do a varnish, so it's just like I'm just going to paint it on. You don't have to put those trays in your mouth.
Oh, okay.
So that'll be even better. So if all that's okay with you,
Sure.
all right. But I do want you to know that we're an educational facility, so we can't be responsible for non-diagnosis or mixed diagnosis.
Okay.
Okay. Now you did see Dr. Anderson, so that's good too, and he is a dentist. But and he didn't really make any referrals for you. Okay. And if for some reason in the future, you can't come, if you'd give us 24 hours notice, that would be really great for the student, so they can try to get another patient.
Okay.
I know, because they're great and everything. Okay. All right. So one of the main things I want to talk about first is thank you so much for bringing your inhaler today. We appreciate that. So according to your medical history, you had an attack not that long ago.
2 days ago.
Okay. Due to the pollen, is that what you
Pollen,
say?
yeah.
It really gets you? Yeah. Okay, so one thing I would recommend here, this is probably why you're having some dry mouth.
Mm-hmm.
Okay? You probably noticed maybe.
I have
Yeah.
very dry mouth.
Yeah, so this is why. But you have to have this
Okay.
in order to live.
Right.
Right. So we can't get rid of this.
Nope.
Nope. So, but we can do some things to help with the dry mouth.
Okay.
Okay? We can, you can talk to your doctor about medications that can stimulate salivary glands. Okay? You can use some over-the-counter saliva substitutes, such as Biotine, but there's different ones out there, especially you go on Amazon.
Uh-huh.
There's one called All Day
Okay.
that I use that's pretty good.
Okay.
Okay, just as you can try some different ones. And do you chew gum?
Sometimes.
Okay, well, if you're gonna chew gum, another thing that'll help is a sugarless gum. Okay, that Trident is one that has xylitol in it. Okay, that's a word that starts. It's one of those ones that starts with an X.
Oh, okay.
But I can, I can write it down for you. Or sorbitol, mannitol. Okay, and those types of gums will really bring your mouth to a healthy pH. Your
Okay.
mouth is acidic after you eat, and then it comes back to neutral after a little bit.
Okay.
We want to keep it neutral because acid is bad,
Right.
right? So we want to keep it neutral, and this would definitely bring down that pH and cause that dry mouth brings down that pH because you don't have that saliva that's helping clear the mouth.
Okay.
Okay, so typically you have more plaque when you have a dry mouth because the saliva is not helping to get rid of it.
Okay.
Okay, so also you can talk to a meter dose inhaler, which will help with the amount that's going into your mouth. So it's not too much, but it's enough.
Okay.
So you could try, something like that. Those are just some suggestions to try to combat that dry mouth.
Okay.
Okay, because it can be very irritating. Yeah, very uncomfortable. Okay, so you do have some gingivitis, okay? Anything that ends with an itis, you know, is an infection,
Okay.
right? So remember when I was probing and I showed you this,
Mhm.
between the teeth and the gums, right? So you do have some gingivitis. So if we take a look at this, would be healthy. Okay. Now your gingivitis isn't like all over. Okay. It's mostly on the top, on the cheek side. Your gums are red,
Mhm.
and then a little bit down here behind your front teeth on the bottom.
Right. And
Okay.
that's where they bleed sometimes.
Yeah. Yeah. There you go. So this is healthy, and this is the bone. So it's healthy bone, you know, your teeth are in bone and fibers. Okay, so this is how some areas look in your mouth. Okay, so you do have some redness, right? Just like if you get a cut on your arm, it gets red and inflamed,
Right.
and it'll bleed. It's the same thing.
Okay.
Okay, so but luckily here, you know, you've got the redness and all, but it's just swollen gums. It's not, you haven't lost any bone.
Well, thank goodness.
Yeah, because you know, you can't really get that bone back once it's gone.
Oh.
But when you come to the hygienist and she scales and gets all that off, like we talked about earlier with the plaque formation, the gums will go back to normal.
Okay.
But then you have to keep it off daily, or they'll get red again. They'll
Okay.
get all inflamed again, and your gums will bleed some more. Okay. But you just have the added problem of the dry mouth.
Okay.
So we've got just have to work on that, okay? So this isn't anything that we can't take care of today,
Okay.
all right? So another thing I wanted to talk to you about though, on your x-rays, you know you have some of those missing teeth, right?
Yeah, before I had insurance, I couldn't afford to
Sure.
do the root canal and crowns.
Yeah, sure. So, so here we see that, okay, let's see. And here you have this, let's just look over here, right? So what we would definitely recommend, because if you see on this side, you know, the teeth are pretty straight. If you look over here though, you see how these teeth, this tooth is kind of leaning? See that? Okay, so it's coming forward into the space because there's supposed to be a tooth there. You know, and then all this gets harder to clean. You know, and we're going to talk about that in a minute when we do the brushing. Okay, maybe some ways to get in there better. Okay, but over here it doesn't look like, you know, this tooth hasn't drifted as much. So we would definitely recommend an implant there.
I don't know if I can afford that, but
Do you have some insurance now though?
I do.
Okay, well, just something to think about, so you don't end up with the same situation over here that you have on the other side.
Okay.
Okay, but the implant's the best option, right? Because you're just replacing that tooth. If you go with a bridge, which is also a good option, okay, then they have to grind down this tooth and grind down this tooth and put a fake tooth here that's connected. Okay, and then you also have your partial, which would be another option, the cheapest option, but also the one that would be when you can take it out
Yeah.
and put it back in.
I don't think I'd like that.
Yeah, yeah. So anyway, that's just something for you to think about, you know, for the future.
Okay. So you're going to write all this down, right? Because there's no way I'm going to remember all that.
Well, I do have.
Could you hold on just a minute? I'm sorry. It's taking way longer than I thought it was going to. Yeah. Okay. All right. Bye. Sorry.
All right, Tammy. Yes, it is taking a bit longer because we are talking about that asthma, right?
I didn't realize it was going to take this long.
Well, what we can do is we're going to get on with it in just a second,
Okay.
okay? But I did want to really talk to you about replacing those teeth because it's just important, and the dry mouth,
Yeah.
okay? And
Well, I try to keep tea or something with me, you know, because my mouth stays dry.
sure. Are you drinking sweet or unsweet tea?
Sweet. It's Southwest Georgia.
I know, it's so good, isn't it? So if you're gonna do that, Do you think you could switch to unsweet or switch to water? Maybe put some lemon in the water to make it, do you drink lemon in your tea?
Yeah, well,
Little? Maybe put some lemon or some kind of flavoring in the water might help.
I can try.
Because that sugar is not, you know, is going to be detrimental to the mouth, to the teeth.
I can try.
Okay, well that's all we can ask. Maybe tea and then then do some water, then maybe a little more tea and then some water.
Okay.
But also if you're chewing the gum that'll
With
help
those-
too. Xylitol.
Xylitol.
Yeah,
okay.
yeah, and using a spray.
Mhm. And you're gonna write all that down, right?
I am. I'm gonna write all that down. And I'm also gonna give you these, because this is about the power brush. You know, we talked about the power brush.
Mhm.
And then also the manual brush,
Mhm.
okay? If you don't decide to get a power brush, and then you're flossing,
Okay.
okay?
So I can't use those picks anymore?
No, well, the picks are okay, like if you're, let's say, you know, you're in a restroom or something out in public, please don't use those at the table though, right? So, the picks are okay just to get the food debris out,
Mhm.
but you know how we talked about the flossing with getting
Right.
under the gingiva, under the gums,
Mhm.
and then going up and down on
Right.
each tooth. So that does a lot better job. Okay, but that's good if you know, just for the minute.
Okay.
Okay, but do the flossing as well as that. Okay. Okay, so Tammy, before I get started too, though, I wanted to talk to you about your toothpaste.
Okay.
Okay, so this, I know you're using some like a Colgate, right?
Whatever's on sale.
Whatever's on sale. Yeah, this would be a good toothpaste for you because it really helps with the bleeding gums.
Okay.
All right, and I'm going to give you a few of those today.
Oh, okay.
Yeah.
Thank you.
And so, and make sure any of your products that you buy have the ADA seal. That's the American Dental Association seal.
Okay.
You know, and so that would mean that they recommend that.
Okay.
Okay. All righty.